My name's Esther, and I'm a principal physicist in radiation safety and diagnostic radiology physics. My job is to look after all the X-ray imaging equipment across a few different hospitals. This includes X-ray, CT, mammography, fluoroscopy, and more.
I'm Mark, and I work in radiation protection and diagnostic radiology physics within the NHS Kent and Medway Integrated Care Board. My job is to keep patients, employees and members of the public safe from radiation.
I'm responsible for keeping radiation doses as low as possible, but I also work with doctors and radiographers to make sure the images we get from the X-rays are high quality. Physicists adjust the equipment to get the best image for the job, and we test all the machines too.
The best thing about my role is the unpredictability. This job regularly gets you out of the office and you just never know what's going to turn up.
I'm a bit of a nerd and I've always loved maths, so the best part of the job for me is being able to use maths and physics to do something which helps people. Something about my job that surprises people is that it exists to begin with. Usually once I've described what I do, people say, "Oh, of course there should be someone to do that," but I've just never thought about it before.
Some of the surprising things I've done in my career have been supporting the police and fire service as a radiation emergency responder, to recover radioactive materials, and helping set up radiation services abroad.
Day to day, I work with the rest of my team, radiographers, radiologists, engineers, and physicists from other specialisms. I also help to teach anyone who works with radiation in the hospital on how to work safely, and I help write the procedures and rules for them to follow.
I get a great deal of job satisfaction working with a diverse range of colleagues at every level of the organisation. Our work involves minimising the amount of radiation that people are exposed to and making sure medical images are good enough so that doctors can see what they need to make a diagnosis. Tens of millions of X-rays are taken in the UK every year, and a medical physics professional is involved in the safe use of each and every X-ray machine.
Even though I often work behind the scenes, my role is an important part of the patient pathway, and I'm proud of the difference I can make.
There are several routes into the profession, such as the scientist training programme, apprenticeships and other opportunities where you can train whilst at work. That's the great thing about medical physics. There's a structured pathway from school through to any level in the profession.
I got to where I am now by doing a medical physics degree and then started on the NHS scientist training programme in medical physics. I chose radiation safety physics because it was my favourite rotation while I was training. You get to work in lots of different hospitals with a huge range of equipment and with lots of different people. No day was ever the same.
There are so many ways to develop your career. Some people will develop their expertise in specialist clinical roles. Some enjoy the challenge of senior management or regional strategic roles. Some like research and innovation and work closely with universities.
Right now, I'm on the Higher Specialist Scientist Training Scheme. It's a mix of leadership and management training, some physics bits which are specific to my job in the future, and a big research project I'll carry out at work. It will take 5 years if everything goes to plan. At the end, I'll have a doctorate and I'll be able to apply for consultant physicist jobs.